LP4 Presentation for Healthcare Administration by Dave King, B.S., CPCS for National American University's MT 6650 Strategy and Policy class for winter semester 2017. The data contained in the report was primarily obtained from the Organization for Economic Cooperation and Development. The OECD is an organization that brings together data and best practices from its 34 member free market economies and 70 other non-member countries. We have over 50 years of statistical data on economy, social, and healthcare-related data by which to determine effective practices for management of a myriad of social and health-related topics. Much of the summary data provided will come from the Health at a Glance 2015 report. The analysis provided will compare the nations of Canada, Australia, and the United States. The first topic to be addressed is around pharmaceutical spending. In the OECD member nations, spending on medications has exceeded $800 billion and accounts for 20% of the money spent on healthcare. While retail spending has decreased in recent years, hospital spending has increased. High-cost specialty medications have spurred discussion about the inefficiencies of the pharmaceutical market, specifically around medications for cancer patients that were being charged over $1,000 per tablet. There's also a need for a reduction in the use of antibiotics. There's a pressing need to reduce this because overutilization of antibiotics makes the patient immune to the effects that it would have benefited from later in life. Pharmaceutical spending looks at prescription and over-the-counter medication spending. The comparison value is not available for Australia, but for Canada, medication spending accounts for about 17% of the healthcare dollars. In the United States, it accounts for about 12% of the healthcare spending. Both of these numbers exclude the cost of medications used in hospitals. Australia has a Pharmaceutical Benefits Advisory Committee which makes recommendations on medications and the benefits to the citizens. The committee has regulatory oversight on the amount of the copay that the patient is responsible for and provides an annual maximum cost after which medications are provided free. Canadian provinces participate in a Pan-Canadian Pharmaceutical Alliance in an effort to negotiate better costs for brand name medications. The United States has the unfortunate policy that Medicare cannot negotiate rates for medications for their beneficiaries. Many healthcare organizations use what Medicare does as the model for how they will act. So were Medicare to be able to negotiate for medication costs, it would give other organizations the same opportunity and take away the power from the pharmaceutical industry. Healthcare spending. The United States is the only country of the three comparative countries that does not have a universal health system. Significant efforts have been made under the Affordable Care Act to provide health coverage to a large part of the population, and the uninsured population is down to about 11%. Payment for out-of-pocket care continues to cause barriers to those seeking health care. 20% of all care across the OECD population is paid by the patients. Economically challenged patients continue to have a sizable need for health care, but are unable to seek the care despite the amounts paid by the governments. Healthcare spending measures the utilization of healthcare goods and services, including curative care, rehabilitative care, long-term care, ancillary services, medical goods, prevention and public health services, as well as healthcare administration, but excludes money spent on investment. Healthcare is financed through a mix of financing arrangements between public, private, and out-of-pocket payments. The numbers presented are a total of these public, private, and out-of-pocket payments measured as its share of the gross domestic product. As we see in the slide, the amount of public and total spending in the United States far exceeds the comparative countries. These are money spent through Medicare, Medicaid, and other defined benefit programs for the underserved. Healthcare spending by country. In the United States, healthcare is a growing business and cost containments are minimal. Medicare limits how much it's willing to pay, and health plans contract for a given service at a given rate, but each of these entities have a need to be profitable. In Canada, the health system has been described as a publicly funded, privately provided, universal, comprehensive, affordable, single-payer, provincially administered national health care system. Australia has a universal health program through which approximately 75% of the healthcare funding is through taxation or defined payments for services, providing a better opportunity for cost containment. Final topic tonight will be patient management. Overweight or obese individuals are those individuals with an excessive weight presenting health risks because of the high proportion of body fat. The most commonly used measure is the body mass index, which is a single number that evaluates an individual's weight in relation to height. Weight divided by height with the weight in kilograms and the height in meters. The World Health Organization classifies adults with a BMI from 25 to 30 are defined as overweight, and those with a BMI of 30 or over as obese. The indicator is presented for both self-reported and measured population. In this slide, Canada is doing a far better job of educating the population, where only about 50% of the population would be considered overweight. There are policy needs that have to occur around obesity. According to an OECD report in 2010, before 1980, the rate of obesity was about 10%. Currently, more than 50% of the population is seen as overweight. Obesity is a risk factor associated with chronic diseases like diabetes and heart failure. Increased need for education on the risks of obesity is a must from all nations. More intervention by governmental entities in banning unhealthy behaviors like sodas in school are needed. In summary, Australia's healthcare system, while costly, provides the benefits needed with limited private party intrusion, which intends to increase the cost to everyone. Everyone is covered. The pharmaceutical industry even has to negotiate with the country to get the best price for the medication, or it's not even allowed in the country. As far as the best program for obesity, Canada wins this one as they managed to maintain their obesity rate right around 50%, while the other two nations could use to get slightly better management. Healthcare is a mixture of private, public, and governmental individuals set to help manage the care and get the patient what they need. Many times these three tend to trip over each other and services can't be rendered, services are too expensive, so on and so forth. The need for these companies and countries and public entities to talk to find a way to move away from profit and more into the care of the patient being the priority. Thank you.